Bismillahirrahmanirrahim. I start the CME with the name of Allah, who is very, very kind and merciful. CME update by Mother and Child Survival Group of Pakistan with Dr. Tariq Masood Khan, Obs-Gynae Family Emergency Specialist, Internist, Gulf KSA, presently a district gynecologist. Today a very important topic, especially in pregnancy, when a patient presents with sudden acute breathlessness, and it is very important to treat the patient urgently, investigate. While being investigated, treatment should be started, and the differential diagnosis will be mostly the cardiac asthma and bronchogenic asthma. There could be other causes of breathlessness like alveolitis and anaphylactic shock, but the most important is the cardiac asthma and bronchial asthma. Cardiac asthma needs urgent treatment because in pregnancy there is pregnancy induced hypertension, there is fluid overload, there is edema, there is stress on the kidneys, and there is with the use of this syntocinon, fluid retention is there. So consider this, you have to have urgent call for the help and resuscitate the patient, set up the patient, prop up at 45-degree angle, IV line, and meanwhile start investigation and treatment at the same time, so that the time should not get wasted. The most important thing is to diurese the patient, as you have to give furosemide, loop diuretic, 40 to 80 milligram, and then you can give also GTN spray, as well as it seems to be an acute left ventricular failure, cardiac asthma, pulmonary edema. And but see that if you are giving this spray, GTN spray, nitroglycerin spray, the BP should be greater than 90 degree, 90 systolic. And then again you have to prop up the patient. You can at this time it is very difficult to differentiate between pneumonia, asthma, COPD, and left ventricular failure, pulmonary edema. So treat them simultaneously with antibiotics, with nebulization, with furosemide and others, so that it works. And then you can also if this is it will improve, though the diuretics they are relatively contraindicated, but it is a matter of life, and the preference is to give immediately the loop diuretic, so as to patient is having breathlessness, and the underlying cause could be valvular heart disease, congenital heart disease, and could be ischemic heart disease, and could be myocardial infarction, and could be pregnancy induced hypertension. So you can nebulize the patient, you can give 100% oxygen, and you can give morphine as well, which is the drug of choice for this acute pulmonary edema, but be caution in asthma, and for that the naloxone should be at hand. And then you can reassess the patient. If it's not improving, then you can start the nitrous infusion as well, but for that the blood pressure should be more than 99 or 100 systolic. And then if it's still not improving, increase the dose, repeat the dose of Lasix furosemide, 40 to 80 milligram, or more than that if it is in the renal failure. So you can then still worse, you can try arterial blood gases, and you can do the ECG, you can do the X-ray, and then this will show you the findings which I will discuss. ECG will show signs of arrhythmias and ischemic heart disease and acute MI. Then still worsening and CO2 signs of CO2 retention, you can see PEP with 5 to 10 per ventilate and this put on the patient on ventilator. Meanwhile, if the PP is low in the range, treat as cardiogenic shock with Swans-Ganz catheter and with the inotropic supports. So this is very important for the need for intubation, and early intubation saves us from the mortality in the hospital because the patient later has to be shifted to ventilator as the muscles got